Do you actually need pre-treatment meds for RSI? Let's clear this up. What's up, you guys? It's your pharmacist, Lil Pharma. Today we're talking about pre-treatment medications for RSI. We're in our RSI series. So we're talking about medications that historically had been used for different things like blunting the sympathetic response to intubation and preventing bradycardia. So first off, let's talk about lidocaine. Initially, lidocaine was thought to decrease the increase in intracranial pressure that's associated with RSI. So especially if you had someone with a traumatic brain injury, you might want to add on lidocaine. However, the data was not good for this, so it's really not routinely recommended anymore. Next up, we have fentanyl. So this was supposed to block the sympathetic response to intubation, and so sometimes people get tachy and hypertensive, which can be problematic in certain situations like a traumatic brain injury or aortic dissection or something like that. But we realized it can actually cause hypotension and is not actually as beneficial as we previously thought. So again, not recommended. Atropine is used to prevent bradycardia, so we still sometimes see this in our pediatric population, and I am not a pediatric pharmacist, so don't come for me on that literature, but in adult patients, we typically don't need this anymore. It didn't actually improve outcomes in our patients. It can be helpful if your patient is already bradycardic or if they vagal down or something like that. Really, we want to simplify our RSI since we're doing this rapidly. So we've got our induction agent, our paralytic agent, and then we move on to watching the hemodynamics and our post-intubation sedation. No need to add in additional complicating factors like pre-treatment medications with no evidence to back them up. Follow along this RSI series for medications we need to be paying attention to in life. That's what I got for you guys. Bye!